Kennedy. My name is Claire Kennedy. I'm a first year medical student and I've been part of the buddy program for about a year. I am now stepping into the role of ambassador along with another student. I first learned about the buddy program during the student sort of exposition fair that we have. So it's in the beginning of the fall. There's lots of clubs and activities kind of set up at booths, and I was walking by and I saw the Parkinson's Buddy Program, and I'd never heard of it, but I knew coming into medical school that I wanted to somehow be more involved in neurology in general because I have a close family member with a rare neurological disorder. So that was something that I wanted to be more involved in. So I went up to the table, I talked to Eric, he was there. I learned more about the program, and at first I was a little intimidated because it's kind of nerve-wracking to sort of sign up and meet a stranger and you're paired with them for the rest of the year and you don't know who it's going to be going into it. But I thought about it and I thought it was a really great opportunity to sort of push myself out of my comfort zone and try something new and different, and also potentially get to make a really cool connection and learn more about, a neurological disease that I didn't have much experience with. So I decided to do it, and it was a really great decision. I was paired with Linda, my buddy. She's awesome. We have a great time, when we hang out. We've done all sorts of stuff, like we've met up with a different buddy student pair and gone out to dinner at Olive Garden just for fun. She also leads a Parkinson's sort of support group that she's invited me to go to, and I've been about 2 or 3 times now, where we go and they'll have speakers come in, talking about, for example, like hospice or different like facilities in the area for people with Parkinson's to use. But it's been really great and awesome, like especially just to see the community, the supportive community that Eric and Erica have built for this, like especially, with my experience having a close family member with a neurological disorder. Like, I would give anything to have this sort of support system and community for that family member. Like, it's really just a beautiful thing. And I think I decided to apply to be an ambassador because I wanted to give back and help to continue to build this really strong community, um, and make it even better than it already is. So, yeah.
Well, I think that the buddy program, the purpose of the buddy program is to really educate the future doctors of the world about what Parkinson's truly is, and also to grow, hopefully, a very in need area of the medical field. Right now, there's about 600 and maybe 650 movement disorder specialists in the nation. And that's a very low number, um, especially compared to the millions of people that have neurological movement disorders, like myself. Um, and one of the hopes and goals of our program is to get these future doctors interested in this field. And hopefully that is something that we're slowly scratching the surface to do. So I think that that is one of our main goals of restarting and revamping this program, is to get these future doctors interested in this program in this field.
Yeah, so I think the biggest impact this program has made has allowed me to build those communication, empathy, listening skills with people with Parkinson's and being able to communicate with them, being able to really learn how this disease affects their life outside of a hospital setting. And throughout the first 2 years of medical school, you don't really get a lot of clinical experience. So this is kind of a great way to really be able to speak with patients, learn how their life is outside of the hospital, what kind of like treatments they get in the hospital, and just being able to communicate with patients and learn all of that. And then just throughout going through this program, I've always been interested in neurology, but after this, I'm like way more interested in neurology, interested in psychiatry and physical medicine rehabilitation, because all of those kind of encompass what we do in this program, learning about movement disorders, learning about people's like feelings and thoughts, and how like this disease can impact not only like your movement, but also how you think and everything like that. Um, but yeah, it just really impacted me to go into a field that can make an impact with these patients as a doctor.
Um, tell me, there is a psychology
Mhm.
to it. I don't think I've heard too many people talk about it. So kind of jump in a little bit more on that. Is it how people think, the
Mhm.
way they react? Kind of, at least from your perspective, build me a picture of how that, somebody with Parkinson's and their psychological makeup.
Yeah. Yeah, I mean, I think psychiatry is just a big part of every single illness. Like, a disease can impact how you might function, but also affects your brain in the same way. If you can't do one thing, it might just affect how you feel because you were able to do this thing in the past, and now you're kind of limited in your ability, and that can take a huge toll on your brain. So I know a lot of people with Parkinson's do go to therapy. They have like treatment for depression, anxiety, things like that just because it is such a major shift from what they were able to before and do now. And I think along with like medicine, everything like that, I think what the program does kind of helps a lot with people in their psychological problems that have to do with illness. So like everything that the program does, like the boxing, pickleball, everything, all these things are kind of a way to outlet any like negative emotions you might have, or just kind of able to realize you can still do all these amazing things, even if you are battling with Parkinson's. So yeah, I think psychiatry is a huge, major part of the disease that people kind of don't really think about. But the things that the program does helps a lot with people kind of getting through this and learning how to find other people with the same problem so they can kind of talk to them and just realize that they're not alone in this.
Do you care if I jump in?
Yeah, go ahead. I was just speaking off the top of my head.
No, that was good. Yeah, I think that like one struggle that is not very apparent, like on the surface of something like a neurological disorder, is the isolation that comes with it. Of like you are going through something and it might be visible to someone, it might not be. It just depends. But like it can be so isolating, and I think the buddy program, but also like, this whole thing as a whole does a really like beautiful job of weaving in like building a community for people affected by Parkinson's mixed with like actual activities that will improve their symptoms. And I think that sort of interweaving is just so special and amazing, to build that community for these people to go and have a space to do some boxing, do some things that are good for them on a physical level, but also equally important is the mental aspect of it. Going and having an opportunity to like speak to people who are also struggling with Parkinson's, or as the support system going with, that person in your family, and then also getting to connect with other people who's or like the family members of other people who are struggling with Parkinson's. Like I think that is half the battle.
Mhm.
And that is like something that you would not think of, I think, when you're first, in the medical school setting, studying in the books, like, oh, what's this disease? What is it on paper? And it's just not really a layer that we are diving into in our studies at this moment. So I think to have sort of, I guess, witnessed that on a personal level has been, I think very influential for maybe the physicians that will be.
Was there something specific that you all have really learned, uh, being a part of the program with somebody with the disease itself? Is there something that just kind of, oh, I really didn't know that? Or, you know,
One cool thing is that my buddy Linda actually has had like an implant.
The DBS.
Yeah, what was it?
Deep brain stimulation.
Yeah, the DBS implant. So it's interesting to sort of like, I think when you think of a disease, it's like you look at someone and you'll see those symptoms, but she has Parkinson's. But I think if you just sort of looked at her now, you wouldn't be able to tell, you know? And I think just seeing how much that one thing has changed her quality of life what is just like amazing, you know? Not to say that she isn't still dealing with other aspects of Parkinson's, but like that has been it's just awesome to see how much technology or medical technology can improve the lives of our patients.
Absolutely.
Yeah, I didn't know those are the kinds that you can take home and you kind of have a remote to kind of
Yeah.
control it yourself and everything.
Yeah.
That was really cool to learn about.
What about you?
Um, I think kind of just going off the same thing. It's like whenever you communicate with these patients and everything, you can't tell they have Parkinson's. So you kind of see the big progress they've made through just keeping up with daily activities. Like some of the big things that help with people with Parkinson's is just doing these games, doing physical activity, boxing, pickleball, everything like that. So just kind of, you can see like people with Parkinson's aren't just how you think they would look. They don't look how you think they would, so they're much more highly functional than you would think.
Would you say there's a stigmatism?
There definitely is. I mean, people kind of, when you look at someone, you expect them to act a certain way when they have disease, and people might judge them when they do act this way, or you might some people think that if I'm trying to think of what I'm trying to say. I mean, okay. Some people might think that they might look at someone and, oh, you don't have a disease because you don't look like you have it. So it just kind of shows the progress you've made when you do have the physical activity and also just the technological advancements and everything like that.
Sort of sort of bouncing off of that, one thing that I didn't know about Parkinson's is like how much of an important role physical activity can play. I was so like astounded by that of just like how much being active can help them manage their disease. Like talking to Linda, it's so funny because she's like, I hate exercise. She hates exercise, but she does it 5 days a week and she does different things to like mix it up. But it is like such an important part of it. And I think that again, this is a thing that we just don't really get into in medical school. We're all about like
It's clinical.
exactly the specific clinical interventions for these diseases, but not about like the not alternative, but like additional things that you can do to manage symptoms that might even be more effective. Like that is something that I will for sure take with me going forward. It was definitely an adjustment. As far as like warming up to my buddy to start with, like I tried because I can be really nervous about like meeting new people. I tried to go in strong. Like I went in and I was like, I'm gonna be outgoing, I'm gonna put myself out there because that I think just makes it easier. So that was not a problem. We clicked like immediately. We had a great time. We were laughing and chuckling, but like there was just, I guess, smaller things that I did not, I guess, like anticipate. For example, like we would be going through the buffet, getting food, and it's I think just those kind of fine motor skills are more difficult for them. And then I found myself in this weird spot of like, do I offer to help and do this for them, or do I just let her take her time to do it because she can?
Mm-hmm.
So I think sort of trying to figure out what the best approach is with that was something that I struggled with, but was also, I think, a very meaningful thing to have to like mentally work through of like, I could help her, I could just do all this for her, but like she can do it herself and probably wants to do it for herself. And if she can, why shouldn't she? Even if it takes her like a couple moments more, you know? So.
Yeah, kind of the same thing, having that kind of ability to kind of help someone, or obviously they can do it themselves and you don't want to kind of step in. I remember I went to a boxing class with my buddy and I was kind of scared of like hitting too hard. I didn't want to like hurt her. Also, like they're a lot older than I am and just building connection with someone who's older is different. It's like talking to someone who's your grandparent and they just have such a different lifestyle and mindset from you. So yeah, I was scared to kind of hit hard, but she was like, "Come on, do it, hit as hard as you can." And yeah, I was just kind of scared to do it at first, but then I realized like they're capable of doing everything that I'm capable of doing, and I feel like you just have to act like how you normally would.
Yeah, and it's kind of cool with the boxing too. When I went with Linda, she afterwards she was like, I have not like gone this hard for boxing in a while, and I was like, I did that. I was here and I pushed her to give it her all because you know. I don't know if I've ever encountered like any like adversity in that sense. I mean, there's been definite like moments where it's not how things don't go how they typically would. I don't know how like quite what the way to say that is, but for example, um, when Linda and I went out to dinner with a different buddy student pair, it took the other buddy a couple like a minute or two to get to the table when we went out to eat versus you walk in a restaurant, they see you're able to kind of keep up, but sometimes like he just needed a little bit more time to get to the table. So I think things like that where you're not thinking that, oh, this might not be like a challenge. That's not a problem to take a minute or two to get to the table, but it's just going to be different. um so things like that. Yeah.
Yeah, I've noticed most people to be pretty patient and like if we went out to dinner and it just might take longer for them to order something off the menu. But I feel like most people are pretty patient and willing to help out when needed to.
I think it's always really helpful to have something, something real to connect the textbook to. So I know when, we were going over neurological disorders last fall, we started to learn a little bit about Parkinson's. I was like, oh, I know already a little bit about this. I actually probably know some things about this that the person teaching me the science behind it doesn't know. Like, the treatment of, physical activity is really good. That's not something that really matters for the PhD, at teaching us. But it's cool to see that like I'm getting things both from the textbook and from my experiences in the program, and together that's weaving a bigger picture than I think I would have gotten otherwise. Yeah.
Yeah, I think just being able to see it, experience it, being able to interact with people with Parkinson's helps you kind of remember the details that you learn in class way more. It just sticks with you because I started this program last year, and then my second year is when we started learning more about movement disorders. We learned about Huntington disease, cerebral palsy, all types of different diseases. And just kind of being able to see it, you kind of be able to compare and contrast what you learned in school and what happens in real life outside of school. So you kind of understand how what happens in clinic might not be exactly what you learn in the classroom, but you can kind of connect the dots and see how it might be similar or different.